Hello everyone, my name is Mirela Dubulescu and I'm here to share with you pearls from sonographers for image optimization and scanning. I'm part of the echo team here at Children's Medical Center, Dallas, Texas, and I work in collaboration with Dr. Gina Killen, one of our wonderful pediatric cardiologists here at UT Southwestern School of Medicine. Our objectives for this presentation are to help you learn what you need to know before heading to the patient's bedside to perform an echocardiogram, the basic functions of the ultrasound machine knobs, and how to use or adjust them to obtain the best diagnostic image possible. Before heading to the patient's bedside, you need to ask yourself a few questions. Who am I going to take care of? Where? Why? And how? Know the patient's medical history, whether the patient had previous interventions or procedures. Location of the patient in the hospital. Is the patient admitted in a CVACU area, on cardiac floor? Is the patient an outpatient? Very important to know the indication for the study. Also know the status of the patient. Is the patient intubated? Does the patient have a trach, an open chest? Is the patient on ECMO? If the patient had a prior echocardiogram, it's important to review the images and make sure you get a mentor to guide your echo practice and correct the gaps in your knowledge and skill set. Once at the bedside, be mindful of the importance of patient positioning and ergonomics. The ultrasound system I will refer during our presentation is a GE E95 ultrasound machine. Before diving into the subject of knobology, let's go over some definitions. What is knobology? It refers to the knowledge of understanding of various knobs, buttons, and controls of an ultrasound machine. Another important term that we want to look into, and we will refer a lot, would be image optimization. Image optimization refers to the process of manipulation of the ultrasound machine settings, patient positioning, probe selection, and adjustments to obtain the most diagnostic image possible. Before heading to the patient's bedside, there are a few pre-scanning considerations that you need to be aware of. Familiarize yourself with the ultrasound system that you are going to use and know how to turn on or shut down the machine. Here we see the turn on and off button circled in red on this particular GE ultrasound system. To pull up the echo order or enter patient information, you will use the patient tab that is circled in red on our image. Make sure you know how and where to connect the EKG cable. It is very important to have the heart rate of the patient on the image. Also very important to know how to select the probe with the right preset. The higher frequency probe will have better resolution, while lower frequency probe will have more penetration depth. It's very important to know that on many patients you will need to make use of multiple probes. For example, you may start with a 4V probe in the subcostal window, and by the time you get to assess coronary arteries, you can use the 6S probe on the patient. Let's look at some examples. First off, let's look into the appropriate probe selection. On the left-hand side, we have 6S, which is the right choice, gives us the best resolution as compared to a 4V probe that's too strong for this patient. We are looking at the AV canal, and on the left-hand side, we are getting a little bit more details of the common AV valve. Before we look into some more examples, let's overview basic types of echocardiography imaging. There's 2D imaging, color Doppler imaging, pulse wave, and continuous wave Doppler imaging. Knowing how to make use of the knobs will influence the quality of the image. It will decrease or increase the frame rate, and is known that higher frame rate yields better temporal resolution, therefore better image quality. This particular image explains this idea. A 30 frame rate per second will give us the worst image quality versus 120 frame rates per second, which will give us a much higher, better image quality. Let's explore a little bit more 2D imaging. Depth button, it is circled in red, and it is important to know that adjusting depth will change the frame rate. For example, if we decrease depth, the frame rate will increase, therefore the image quality will be better. Adjusting depth appropriately will help the reader focus on the anatomical cardiac structures you are assessing. On this slide, we have an example of too much depth versus appropriate depth. On the left-hand side, we have an image with a sector that almost half of it is wasted versus the image on the right-hand side where the depth was adjusted and we can focus on the cardiac anatomy. With only one change, more particular, adjusting the depth, we change the frame rate from 92 to 109. Let's move now to sector width. Adjusting the sector width will also increase or decrease the frame rate. Smaller sector width will increase the frame rate as compared to a wider sector width that will decrease your frame rate. Here we have examples of images with wide versus smaller sector width and how the frame rate increased from 44 frame rate per second on the left-hand side image compared to 56 frame rate per second on the right-hand side clip, just by adjusting the sector width a little bit. Let's talk next about what the different small adjustments of 2D overall gain, iScan, and TGC can make. Undergain image is too dark and can miss information as compared to overgained image that's too bright and can lose its details. iScan button is also called a fellows button. With just one push, you will adjust the gain. If the gain is too bright, it's usually in this area. This here is the overall gain, and this is the TGC set of knobs. TGC actually allows you to adjust gain at specific depth horizontally. Here we have examples of 2D imaging showing the difference between the appropriate 2D gain here on the left-hand side. I will play it again. Versus too much gain on the right-hand side. See how much prettier the image on the left-hand side is. We can see in these examples how the use of TGC can correct the overgained lower portion of the first clip we see here, too bright, and gives us more balanced 2D image here on the right-hand side. Another important button or knob of the ultrasound machine is the compression or dynamic range button. It's usually on the touch screen on this particular ultrasound system. If we want softer images, we have to increase the dynamic range as compared to more contrasty images when we decrease the dynamic range. We can see in these two images how adjustment of the dynamic range or compression help the left coronary arteries appear more obvious, easier to assess. On the right hand side, we have increased compression, meaning less shades of gray, which makes those coronaries easier to see. Focus is another important knob to pay attention to on the older versions of ultrasound systems. Newer ultrasound machines, like this particular one that I'm showing you, have a built-in autofocus. You don't need to worry about it. This is a frozen image of an adult orientation of apical 5 chambers that displays the focus position on this image. It's where the image is most clear. If you want to take a closer look to an area of interest and eliminate distractions, zoom in button is the knob that you want to use. It's circled here in red. We have here on the left hand side frozen image of parasternal long axis that assesses the mitral valve. On the right hand side, we have a zoom in version of mitral valve view here. Up down button is also an important one to know how to find and the use of its function. Usually it's found on the touch screen on this particular ultrasound system, and it's used to flip the sector position, vertex up or vertex down. And because an image talks louder than 1,000 words, here we have example of the image with the sector up. It's a side sweep. On the right hand side, we have an image with the sector down, and this is a coronal sweep from the subcostal view. Acquired knob, circled in red, very important. The cardiologist cannot read your images if we do not make use of this knob. The acquiring of the images can be done prospectively or retrospectively. This is something that can be pre-selected under utility configuration tabs, and the length of the clip can be based upon cardiac cycle versus seconds. Next, we'll move on to color Doppler imaging. What is color Doppler? Color Doppler uses an enhanced form of Doppler technology to assess direction of blood flow. Blue color represents blood flowing away from the transducer, and red color represents blood flow towards the transducer. Color Doppler gain can be adjusted, but we have to be careful to not underestimate or overestimate regurgitant color flow jets or stenosis by decreasing the color gain too much. Here is an example of color Doppler imaging. Blue, as I said, is blood flowing away from the transducer, which is where the V is, and red is blood that flows towards the transducer. Next, we'll talk about the importance of the Nyquist limit and how to adjust it. Nyquist limit is the maximum velocity that can be measured without aliasing. Low flow is better seen when Nyquist is lowered, and an example of low flow is pulmonary vein flow or coronary artery flow. High flow is better assessed with a higher Nyquist limit and color noise is reduced. And an example about high flow is flow through the pulmonary valve, flow through the aortic valve, flow through the descending aorta, and much more. We adjust the Nyquist limit by manipulating the scale knob, which is displayed circled in red. Here we have two examples of an optimal Nyquist limit and a low scale. On the left-hand side, the Nyquist is appropriately adjusted. We see clearly the regurgitant jet. On the right-hand side, the scale or the Nyquist limit is very low, 0.16, and we can see how messy and aliasing the regurgitant jet is. It is very important to adjust the color box size. You adjust it to the region of interest to improve your frame rate, and to do so you make use of the two buttons circled in red. Here we have an example of an appropriate color box size that focuses on the flow of the aortic valve in parasternal long axis image. Color compare or simultaneous images can be used but not abused. Be mindful of how often you use it and know that it decreases resolution of the 2D images. Here we have an example of color compare or simultaneous images. On image A, we see left atria, left ventricle, and mitral valve in 2D. And in image B, we see the color flow through the mitral valve. In this particular case, the color compare helps us determine the mechanism of the mitral valve regurgitation. Next, we'll look into pulse wave versus continuous wave Doppler imaging. Pulse wave Doppler is used to sample blood flow of a specific region. We use the cursor to place the sample volume in the region of interest and is limited by the Nyquist limit. Very hard to assess high velocities through a stenotic valve, for example. On this particular slide, we have a visualization of the pulse wave Doppler concept. We see the sample volume circled in red, and it is placed below the mitral valve at the leaflet tips, and it will assess the inflow through the mitral valve at that specific point. Continuous wave Doppler next. It is used to assess high velocity flows along the entire Doppler line at no specific point. Here we see an example of continuous wave Doppler assessment of the mitral valve, and we see the regurgitant jet below the baseline. This is another example of continuous wave Doppler imaging, where on the right hand side we see that the scale and the baseline were adjusted, and you can actually measure the highest velocity of the flow as compared to the image on the left hand side, where these adjustments were not made and you miss the highest velocity. Just to wrap up, we'll go over some final pearls. Utilize all methods to optimize your images and increase your frame rate. Do not stay married to one spot. Learn one set of views at a time, and once you get familiar with the standard views, do not be afraid to try non-standard views. Thank you for your time.